Are chiropractors and some other health professionals, are they scamming you? So this might be my most important video yet. The short answer is yes, yeah, sort of, sometimes. It depends. Now, what do I mean by scamming patients? I mean misinforming patients. I mean not educating patients enough to make informed decisions. I mean misdiagnosis. I mean mismanaging conditions. And I mean suggesting treatments and treatment plans based on financial gain. Now, some of this may be malicious, but maybe not. Maybe they just learned this from their training or from a mentor. For example, they might not know proper management based on the latest research, so their recommendations are in good faith. Some information, and particularly subtleties, gets lost in the fire hose of information doctors receive. We all memorize the most likely stuff that will be on the board exam. We don't memorize, the alternative treatments, not other possible diagnoses, what's going to be on the exam. So there are chiropractors, medical doctors, dentists, and physiotherapists, confident they're doing the right thing out there as they do the wrong thing. Some part of scams is to blame on insurance companies. And even myself, I would modify treatments slightly so that I could bill insurance for more money or so that billing is easier. But they wouldn't pay me if I billed what I wanted to bill. If I reassess each visit, I spend 15 minutes on it, they're not going to pay for that. If I do more than a 15-minute unit of time of soft tissue work, they're not going to pay for that either. So I do those things anyway, but I might multitask or waste a little bit of time doing something less effective or useless just so I can get paid, or I get creative with my interpretation of the coding descriptions. We're going to revisit insurance when I get talking about chiropractors. The other common trend related to insurance is hiding pricing from patients until afterwards, which is just crazy to me. When I had my clinic in the States, my pricing was up on the website, and I bet you would be hard-pressed to find others who would do this in the States. Let's talk about a few scams before getting to chiropractors. Corticosteroids, way overutilized, and you're trading, possible short-term pain relief with tissue weakening. Most don't realize the research says to use them extremely cautiously or not at all, and most don't even know that the conditions that they're using corticosteroids on, they're not inflammatory. They used to be thought to be inflammatory. We now find that a lot of these conditions, they're not inflammatory, they're degenerative. So you're using an extremely powerful anti-inflammatory on something that isn't inflammatory. It's the wrong treatment. Speaking of incorrectly understanding the issue, if you have a diagnosis of hip osteoarthritis or trochanteric bursitis, the pain is most likely from muscles or tendons and probably not the normal age-related bony changes or the increased fluid in the bursa. What's another one? GERD, acid reflux, heartburn. What gets prescribed? A proton pump inhibitor. And these are FDA approved for short-term use only and to be used until lifestyle recommendations or surgery can fix the problem. But most patients get prescribed them for life and are never even given these lifestyle recommendations. Similar for diabetes, where lifestyle recommendations are recommended by basically every health organization out there, and there's a mountain of research behind it, and it should be a first-line treatment, but does it happen? Now, these examples so far are more of a lack of knowledge, perhaps, or being in a rush. What about a financial incentive? What about Botox? When I was in the Cayman Islands, I was surprised how many patients had had Botox injections from doctors or dentists. Based on my reputation, I was getting over 50% of my patients with headaches, and they'd all had Botox at one point. Why? It's because it was often the first treatment attempted. Any person says, yeah, I'm getting a headache lately. Oh, let me inject you with Botox right away. And the reason they were doing this is they could charge insurance $5,000 for the injection. And it's not just doctors, it's dentists too, because it's not just headaches, injections for jaw pain, grinding, anything related to the jaw basically and the muscles. Botox, $5,000. Yeah, we're in the money now. Speaking of dentists, how many people think of the dentist first when they have jaw pain and the dentist recommends a mouth guard? The mouth guard protects the teeth from grinding. It isn't treating the joint and muscle pain. Now, strangely enough, there is a very small subset of people that actually do get some of their jaw pain relief, but that's not what the mouth guard is for. That's not what it does. It protects the teeth. And even if a dentist does recommend something, they'll recommend, oh, just try to de-stress or something, maybe do some counseling. But the number one treatment for muscle and joint issues is muscle treatments and exercises, and possibly surgery. The same stuff for joint pain and of the other joints. Honestly, you can treat all the muscles in the mouth in like 10 minutes. Why aren't dentists or dental assistants trained in this is beyond me. Let's pick on naturopaths and functional medicine doctors. They order a bajillion expensive tests and recommend all sorts of supplements and botanicals. Some of it is outright scams, such as homeopathic remedies which contain no active ingredients. Some of what they do is based on research studies and case studies, but they often misinterpret or misunderstand the research, which results in silly treatments like charcoal cleanses. I do admit some of them do find an obscure root cause of disease in some, and they do manage to treat it, but for every one person who's miraculously healed, there's half a dozen who paid a fortune for small or no results. But I think, this would be close to the case even for the best doctor. Catching an obscure disease does require ruling out the common problems. I've said before, practicing functional medicine well is just normal medicine, but done well. Let's pick on physiotherapists for a bit. They're often trained on exercise protocols, which sort of makes sense since research also requires a protocol to test, and protocols are easier to teach than the alternative. And the alternative being to adapt the exercises to each person and reassess and modify each visit. There's so many people out there who go week after week just to do the exact same exercises again and again. They max out their insurance and then do it again the next year. Even worse is physios who don't do any rehab at all, but just heat or cold or e-stim, to TENS or IFC, visit after visit. Both cold, heat, and e-stim do not help healing at all. They just offer symptom relief. Also, therapeutic ultrasound is no better than a hot pack for almost all conditions, despite what a lot of physios may have been taught. Now, I even know some physios who know it doesn't really do anything, but they still use it anyway for the placebo effect. Is that a scam then? When they say, okay, this is going to make it better, it's going to help healing, but they know it won't. What should physios do? Make sure scar tissue is all broken up, make sure muscles and tendons are strong, and make sure the muscle and joint coordination is smooth and coordinated to prevent re-injuries. And it's the neuromuscular retraining that is often the most forgotten. Now I'll tell you a story of a patient of mine. He was in his mid-80s. He was retired and he was very distraught when he first met me. He was doing all the physiotherapist exercises, and I mean all of them. He was exercising 1 to 2 hours every day. This guy was stronger than me. He also had an MRI brain scan and visited a neurologist. Both the physio and the neurologist both said there was nothing wrong with him, but he says he keeps falling over. I tested him with the standard balance test, and his balance was better than mine, which is no surprise because he'd been practicing it every day for the past few months. Well, under what conditions do you fall? Well, he said, in the kitchen, putting away the dishes. So we reproduced this scenario, with a small hand weight and, pretend that the cupboard is here. And yeah, he almost fell over. So this is what we have to work on. And he wasn't keeping his feet under him while he was reaching. His feet didn't automatically move to support his center of balance. Now, he also had issues with walking and getting in and out of the car. For walking, I attached a band to him and I'd either pull him or I'd shove him randomly. If he trains like that, then normal walking will be a breeze. For the car, we went out to the parking lot to practice with his car. I think it was about 2 weeks of working together, and he was so happy to be confident in moving again without falling. He said he was even thinking of taking up running again. I'll add that he also did a lot of exercises at home. And at home, non-supervised daily exercises, I feel, are not emphasized enough by some physios, resulting on a reliance on the physio for any level of activity or exercise. Whereas if the exercises were done daily, they would get better 2, 3, 4 times as fast. And for some people, they would actually get better instead of sort of being stuck at this plateau. Okay. I must admit, I'm a chiropractor. I'm proud of my training and the people I've helped, but I'm always embarrassed to say I'm a chiropractor. I was trained in Oregon, where chiropractors are primary care physicians. We did not learn traditional chiropractic philosophies or much of the history of chiropractic. The program was very diagnosis and rehab exercise focused, and these chiropractic adjustments were just a quick way of loosening muscles and reducing pain so you could get into the real work, which is the rehab, patient education, and getting the patient back to doing their activities of daily living. So it was constant reassessments, adjusting treatments to ensure continuous progress, ordering imaging, or referring out for surgery if necessary. The training was good. It wasn't perfect. I'm good. I'm not perfect. I do hour-long sessions and very rarely do cracking adjustments unless requested, or for just general mid-back stiffness. Gentle joint mobilizations or other types of soft tissue treatment like breaking up scar tissue normally suffices and can be more useful, particularly in the long term, than a crack. The training I got was equivalent to a medical doctor's. Similar level, similar courses, similar number of hours. MDs get more internal medicine and pharmacology, we got more neurology, radiology, and of course, the chiropractic treatment specific classes. Some of the instructors even taught at both the medical school and the chiropractic school. Just like for newly graduated medical doctors, I was still unprepared. I was mismanaging cases unknowingly, so I did more education, multiple specialties, and I feel the way I work is not a scam. I was taught that you should always be trying to put yourself out of business. This is healthcare. You want to put yourself out of business. That's what you should be trying to do. Don't get addicted to crack. Don't let your patients get addicted to the crack. So I would say I'm not a scam, and I don't scam people to the best of my ability. But the way I work is not typical, and frankly, it's not profitable. Now, it isn't profitable on 3 levels. First, my patients get better way too quickly. Second, I spend too much time per patient. And third, insurance won't pay me, or at least they won't pay me enough. The first issue is sort of tied to this myth of required maintenance, and also the lengthy treatment plans that chiropractors are known for. Honestly, most people get better over the span of a few weeks. So in reality, you're paying a chiropractor, to help loosen you up and for some temporary pain relief while waiting for your body to get better on its own. But that isn't how it is marketed. Look at these x-rays. You have so many subluxations in your spine. It needs to be realigned. You need to come in. The nervous system needs to get treated by my super special chiropractic adjustments, and you need to be realigned. I remember making my intake paperwork, and to make sure I was following all the rules, I decided to check out the local chiropractic school's intake paperwork to copy. At the end of their intake form, there were a few checkmark boxes. Yes, everything is correct to the best of my ability. And then the second box, yes, I understand that there may be no results unless I commit to at least 12 visits. What a scam. When chiropractic adjustments actually fix an issue, are actually curative, it is typically a miracle visit where it's just 1 session, maybe 2. Happens occasionally with rib pain and pelvis pain mostly. So chiropractors tell people, I need to see you for at least a dozen visits for any issue. It's cumulative. You need to keep on coming in. And then regardless of whether you get better or not, for maintenance, you have to keep on coming in regularly the rest of your life. Look at some job postings for chiropractors. Under requirements, must teach patients the importance of routine chiropractic care. I still think of a past boss chastising me for patients who weren't returning regularly because they got better. You got to get them to come back for maintenance, right? He never came for routine maintenance. He never came for routine chiropractic care. I don't get or want routine chiropractic care. And while we're on the topic, I would teach people my stretches and treatments if they were the type to keep on coming back, so they would have the option to self-manage. Teaching spouses how to do ischemic compression on the muscles to get rid of tension headaches, or how to use one of those clicking activator tools on themselves to help with neck discomfort, or a useful back stretch to replace the chiropractic adjustment. The second reason I wasn't profitable was me spending too much time on patients. Traditional chiropractic treatment sessions are about 5 minutes long. Many chiros see 50 to 100 people a day. And this is the reality. Even if you want to spend more time, you can't do it profitably. At those volumes, even charging a low cash fee, you can still make a decent profit. I would see in between, 4 to 12 patients a day. And that's it. The third issue is insurance dictating treatment. Insurance normally only pays for chiropractic adjustments, and they rarely pay for other forms of treatment. So for insurance patients, you make the same amount of money spending 5 minutes as you would for spending 30 or 60 minutes with them. You're basically doing volunteer work at that point. For me in the Cayman Islands, I could max out insurance with 15 minutes of work. There's no financial incentive to spend more time on them that day. You can have them come back again tomorrow and the day after. Each day you can get that bill and you can max out insurance. But then you hardly make any progress. It really sucks. Let me talk about two very different chiropractic franchises that in some ways they're not scams. The first is The Joint. It's a cash-based traditional cracking business, and as a company policy, they only treat joint stiffness and achiness. They're not supposed to treat any sort of diseases. Think of it like getting a quick massage. The expectation is and should be to just get loosened up and, oh yeah, it feels a little bit better. Yeah, that's cool. Although, as I understand it, some of the chiropractors do really push for the benefits of regular treatments. Anyways, the second company is Erosti. Erosti has its own training and trains all their employees in fascial work, in muscle work, and rehab exercises. They only do 1-hour sessions. Chiropractic adjustments are not a standard part of their treatment protocols, and they don't bill for them. They promise, based on their data, that they get people better faster. They went to the insurance companies with this data, and they negotiated with them to get a custom agreement to be paid 2 units of soft tissue work and 2 units of exercises per visit. But a normal chiropractor can't get that deal. It sucks that if you want to help people in the best way, insurance won't pay you. Now, so far I've come at this from sort of a profit perspective. There's also the tradition part. This concept of bone out of place, squishing the garden hose of your nerves, it's outdated. There are those out there and some schools that worship the teachings of the first chiropractor, and they talk about the green books, like they're some sort of Bible. So for example, let's say you had pain in your little finger, they wouldn't look at your little finger, they'd go to your neck, okay, I need to adjust the CT joint because that's where the C8 nerve is, and that will free up the flow in your nerves, and then God's innate intelligence will be able to flow through your nerves to that region and will cure its dis-ease. And I said it that way specifically. They call it dis-ease. And in fact, they believe all dis-ease is from spinal misalignment. What bullshit. Not to say that these chiropractors don't help some patients. The boundless confidence and the optimism that they have surely helps with the placebo effect. And they do give some pain relief and improved joint mobility. And you do have the rare conditions that are cured by quick joint mobilization, like some rib and pelvis pain. Oh, and chiropractors. They fall for scams and they perpetuate scams all the time. Many suggest homeopathic remedies, for example. There's also this treatment or assessment really called applied kinesiology. It sounds fancy, sounds really scientific, right? But one use of this applied kinesiology is to figure out food sensitivities. Having the patient hold the food in their mouth or in their hand, and then you push on their arm to see if they're weaker with the food. To see if they're weaker or stronger. If they're weaker, the food is bad for them, and if they're stronger, the food is good for them. Obviously this doesn't work, and it can fool a lot of people. I was in fact demonstrating this to a group of my friends, and one of them was convinced it actually worked. Oh, I swear, I really felt weaker when you put the candy in my hand. Are you sure it doesn't work? What about kids? Babies and kids? Chiropractors preying on parents' fear, you need to bring your children in or else. Or claiming to fix any sort of developmental delays. Now, not to say they can't help kids. I worked on a kid before, and it was a couple years after they had had a car accident, and they did have a whole bunch of scar tissue in their back. And if your baby is behaving strangely, particularly moving asymmetrically, like only moving one arm, only turning their head towards the right, then getting an assessment can be very worthwhile. My new baby gets hurt all the time. Now, she can't tell me verbally, but I occasionally check out her muscles and joints, and I do a little movement assessment. At birth, her neck muscles were hot and swollen. They were totally chewed up and torn. And sure enough, she did seem to have trouble turning one way and preferred to turn the other way. But just a few days later, she was turning both ways just fine. Once I could tell she had injured her shoulder, because she wasn't reaching forward with that shoulder anymore. But again, after a couple of days, she was fine again. I also know she occasionally sprains her toes, but they're back to normal in a day or two. Babies and kids heal so fast. They don't need regular spinal alignments. They need activity and fun. Maybe an occasional assessment every once in a while wouldn't hurt, I suppose. Then there's this balloon treatment in the nose, sometimes called nasal specific. And this is claimed by some to move the bones of the face, The bones of the skull are move, which is wrong. But they claim that they're going to restore motion, and it acts as a natural facelift, moving the bones. Now, I use that technique. It's a little strange, but it is fantastic for chronic rhinitis and postnatal drip. It works most of the time. And it does seem to help those with post-concussion. But there's no need to make such outrageous, unscientific, unfounded claims that make the treatment and the whole profession look like pseudoscientific fools. Now, I could go on almost endlessly. Maybe this is a good place to stop. I hope you found this useful or entertaining. Cheers. Now, I want to add that you have to take what I've said and you have to interpret it a bit carefully. Something like proton pump inhibitors, I'm not saying they should never be prescribed, it's just that they shouldn't be prescribed forever. I implied that longer, almost half an hour, hour-long sessions are the way to go for treating patients properly as a physiotherapist or a chiropractor, but not all patients need an hour. There's plenty of people I've helped in 5 minutes, 10 minutes, 15 minutes. My wife with pelvic pain from being pregnant, a few times during pregnancy, she got very severe pain, and within seconds, sometimes her pain was gone. Same thing with headaches, sometimes 10, 15 minutes and the headache is gone. And honestly, if I'm working headaches, I don't want to work on someone for more than half an hour. So again, just take what I've said with a grain of salt and take my complaints or interpret them carefully. Anyway, cheers.